Our top story tonight. Reports obtained by the BBC show failings in how Jersey's authorities dealt with children at risk of abuse as recently as last year. The reports, commissioned by the then interim head of Children's Services, reveal that agencies weren't working together and were slow to act on suspected neglect or abuse. Health and Social Services today have said they're investing millions to improve the situation. Luxmy Gopal reports.
Children's needs are not consistently responded to in a timely and effective way. Lack of monitoring, lack of clarity, sometimes with avoidably negative consequences.
These findings into Jersey's Children's Services weren't from the inquiry into historic abuse, they were from just last year. From reports made months ago, confidential until now. They were commissioned by Jo Olsen, appointed temporarily to troubleshoot Children's Services. She appointed a former Ofsted inspector to review cases that arose between last May and July. The reports came to light in February this year when mentioned in Jo Olsen's evidence at the Jersey Care Inquiry. They've only now been released following a BBC request.
These reports looked at how different agencies, including police, healthcare professionals and social workers, reacted to suspected child abuse or neglect. The findings show they didn't work together effectively, didn't fully understand children's needs, and some cases were closed before they should have been.
The cases of 7 children in particular raised concerns about missed opportunities. The minister responsible has promised to improve resources.
The report obviously is not what we would like to read. It was commissioned by us. We're investing £5.5 million this year in improving services, and that report sets a line in the sand, does say very clearly that young people are not at risk, but we don't listen to them. We must change that.
The states are releasing 2 more previously confidential reports, which could further reveal whether Jersey's come far enough in protecting children from abuse. Luxmy Gopal, BBC Channel Islands News, Jersey.
So how do people who've been through Jersey's care system feel about the reports? I asked a lawyer, Alan Collins, who's acting for many of them in the care inquiry.
They're very disappointed because they had understood that change for the better was being brought about. But whatever's been going on clearly has not been enough.
We have heard a lot about historical failings in children's services in Jersey. Were you surprised then to find these reports identifying that there are still problems in the system?
For me, it is a cultural issue that's got to be addressed, and that is why the Jersey Care Leavers Association has been arguing that there needs to be a children's ombudsman, someone who is independent, who can drive forward change, who can ensure that standards are improved, can ensure that there is accountability. Because unless you have that, the risk is we'll be having similar reports down the line in years to come, and that would be tragic.
The Health Department today have said that the failings identified in the report were mainly due to a lack of resources. But I take it when you're talking about cultural change, you're not talking about throwing money at the problem. There must be something more than one person, one ombudsman, who can affect change here.
It's about having good people who are well trained, well motivated, who are in a service that's evolving and is keeping pace with all the changes in child welfare issues. It's not just about money, it's about a completely different mindset.